Good afternoon. I'm starting off, Tina, I don't see a live. Oh, now I'm live. Good afternoon, everyone. If you're in this room, you are here to attend the 2021 Healthy Community Awards ceremony. Thank you so much. We were just getting all of our ducks in a row, as they say, and sorry for starting a few minutes late. My name is Camille Rodriguez. I'm the Executive Director of Boulder County Public Health, and I'll be serving as your MC today. I'd like to introduce a couple of our esteemed guests to start off with and give them a chance to say a couple words. First, I'm honored to introduce Boulder County Commissioner Marta Lochamin, and you are here to join us today for this great event. Marta, would you like to say a couple words?
Buenas tardes a todas las personas que están aquí con nosotros hoy. Gracias. Y realmente hoy es una celebración que estamos compartiendo como un ejemplo de las relaciones importantísimas que existen en nuestra comunidad. Tenemos contribuciones y participación de una gran variedad de organizaciones en el condado de Boulder. Y estamos súper agradecidos a todas ustedes. Es una demostración de la importancia de salud y bienestar de todas las personas aquí en el condado de Boulder. Y queremos darles felicidades. Mi nombre es Marta Lochamin, soy parte de la mesa directiva de aquí del condado de Boulder y una comisionada. Thank you everybody for participating today in the Healthy Community Awards. We are really excited about this celebration. It's an example of the really important relationships that exist in our community. We have contributions and participation from a really wide and huge variety of organizations in Boulder County, and we're really happy and we're very thankful to all of you. It's a demonstration today of the importance that health and well-being of all of us in the Boulder County area support and encourage. So felicidades a todas las personas que están participando. Thank you for joining us today.
I think this is my turn.
Yes, I wasn't sure if I needed to wait to see a little live icon, but I would like to take this opportunity to introduce the president of the Board of Health, Greg Thomas. Yes, it is your turn, Greg. Thank you.
Good afternoon, everyone, and congratulations. This was looks like a pretty diverse and pretty awesome slate of awardees. I have been on the board for about 10 years now, and I believe this is my third Healthy Community Awards. I see some very familiar names and faces, and also one of our esteemed former board colleagues, Jorge. And so this gives me great pride to see really the diversity of the programs that are being awarded today. I look forward to the nominations and hearing more about them. So congratulations again, and thank you.
Thank you so much, President Thomas and Commissioner Lochamin, for those great welcomes. I don't even need to say more about how important this is. I do want to take a moment to also welcome any past winners who are present. I haven't been with the county long enough to call you out by name, but really what an honor to have all of you here, including anyone who's been honored in the past. I'm going to start off with a quick background. You know, the purpose of the Boulder County Public Health Healthy Community Awards is to recognize individuals and groups, agencies, and organizations that work with public health to address public health needs and issues in Boulder County. Our recipients have demonstrated in an exemplary way the Boulder County Public Health mission and values, and they've developed and implemented strategies to help improve the health and well-being of the people and of the environment of Boulder County. This is about recognizing the accomplishments of public health, and we know that we can't accomplish our mission at Boulder County Public Health without the help of our partners. Community collaborations and partnerships are critical in accomplishing the work of public health. and the engagement of community partners is evidenced by over 200 collaborative relationships that we have in this community. There are many worthwhile partners in our community, and our committee has selected many of you in this room to receive a 2021 Healthy Community Award. They include A Woman's Work, Norma Portnoy, the ecocycle schools program, community economic development partners, including the Latino and Boulder Chamber of Commerce, the Boulder Valley and St. Vrain school districts health services staff and the private schools COVID staff, the BoCo Beans institutional supporters, community ambassadors and cultural brokers, the COVID-19 volunteers and the Medical Reserve Corps of Boulder County, and the Community Infectious Disease Emergency Response Team, and finally, the Healthy Drinks social media campaign. Today, you will hear highlights presented about these exceptional award winners that demonstrate that together we can and do make a profound difference. And the format for our event today will include an introduction by the nominator from Boulder County Public Health, followed by a few words by the winner or their representative. So I'm going to go ahead and start by introducing our first recipient. A Woman's Work is being honored for their efforts for providing financial support for women in the St. Vrain Valley. By assisting hundreds of women for over 2 decades on a wide variety of needs, including childcare, housing, transportation, medical needs, education, training, and more, A Woman's Work has made our community stronger. I'll turn it over to Julie Ackerman, nurse home visitor of Nurse Family Partnership, to introduce the Woman's Work and the highlights of their accomplishments. And after she speaks, this award is being accepted by Kate Gaddis, Executive Director of A Woman's Work.
Hello, everyone. I'm Julie Ackerman. As Camille mentioned, I'm a nurse home visitor with the Nurse Family Partnership Program. Our program supports first-time pregnant women during pregnancy and continues until their child turns 2 years old. When I began this role in 2014, I had the pleasure of attending a partner orientation meeting hosted by A Woman's Work. And it was there that I learned about the amazing work that this Longmont-based nonprofit organization performs regularly for the women of the St. Vrain Valley. A Woman's Work mission is, as Camille stated, an organization that provides financial support for women within the community whose immediate needs cannot be met by other sources. They provide a wide range of services. They don't accept government funds and do all their fundraising themselves, and 100% of every donation goes directly to support these women in need. Grant applications are submitted by community partners like Nurse Family Partnership, and the decision to approve the grant request is made by an objective board of directors who is unaware of the identity of the grantee. After a generous award is approved, and that happens typically within a week, the payment the organization requests is simply a pay it forward act of kindness from the recipient, big or small. Nurse Family Partnership has had the honor of witnessing firsthand the positive impacts these financial grants have had on the women enrolled in our program. Over the years, A Woman's Work generosity has improved the lives of women and families throughout our community, creating a ripple effect of kindness, health, and success. Some examples of assistance they have provided over the past year alone for Nurse Family Partnership is they purchased a laptop computer for a woman, which allowed her to stay home and continue her work during the pandemic. They paid rental costs for women 7 specific occasions over the year, many times allowing women to use that rental cost savings for other needs they may have. One interesting instance was that it allowed a woman to offset those funds needed to pay for a caregiver to come into her home and provide care for her special needs brother who could not stay alone during that pandemic when the day program was closed. They purchased 2 cases of specialized formula that WIC was not able to provide for a woman. They awarded a $2,500 education scholarship that allowed a woman to continue her education at Front Range Community College. They paid for automobile repairs for 2 women that allowed them to continue their work. And they provided a car payment also. Certainly, when unexpected hardships arise, a woman's work assists women and their families in our community to continue a path towards health, success, self-sufficiency, and they maintain individual respect and dignity while doing this. With that, I am thrilled to have the privilege of introducing Kate Gaddis, the Executive Director of A Woman's Work, who will accept the first of this year's Healthy Community Awards for the very deserving organization, A Woman's Work.
Hi there, can you guys hear me now? I'm not sure if my video is working or not. We were having some issues before, but I just want to, I'm thrilled and pleased to be with all of you today. Julie, thank you for that beautiful introduction and synopsis of what we do at A Woman's Work. We have been serving women in need in the community for 18 years. We're having our 18th anniversary luncheon this Friday. In fact, I've been working a lot this week to get ready for that, but we're thrilled to be partnered with organizations such as Nurse Family Partnership, Julie, and other Boulder County organizations. We are connected with over 300 partners in the community, and we could not do the work we do without all of you. You guys are our eyes and ears in the community, and we're just so grateful to be a part of this community that, as I've always said, we all sort of wrap our arms collectively around the people that need it, and we're happy to fill the role that we do. So thank you again for having me. Thank you for this award. I'm just honored to be here amongst all of you today, so we appreciate it.
Thank you so much, A Woman's Work. It was amazing to hear about all that you do. And I'm going to move on to our next recipient. Norma Portnoy, sorry if I've mispronounced your name, Ms. Portnoy, is being recognized for potentially saving lives in our community by increasing community and organizational capacity to advocate for naloxone in schools. You not only help the residents of Boulder County, but all of Colorado. I'll turn this over to Audrey Schroer, Community Substance Abuse Prevention Planner, to highlight Norma's accomplishments, and Norma is here today to accept the award.
Hello, and good afternoon. I have the pleasure of introducing Norma Portnoy as a community volunteer and member of the Boulder Rotary's Behavioral Health Committee. Norma Portnoy saw the need for all middle and high schools in Boulder County to keep naloxone, a safe and effective medication that can reverse an opioid overdose on school campuses, as a harm reduction strategy to save the lives of young people using opioids. In order to meet this need, she collected research and created a toolkit for Boulder County schools about the importance of carrying naloxone and strategies to support its deployment in schools. She collected materials from the National Association of School Personnel Administrators around staff education for how to use naloxone and sample policies for storage and use. She created sample letters of support for community members and organizations to use when advocating for naloxone in schools, and identified a statewide funding source for schools to obtain naloxone for free, and created instructions for how schools can access this fund. And if that's not all, over this incredibly challenging past year, Norma has increased community member and organizational capacity to advocate for naloxone in schools, not only in Boulder County, but across Colorado. She promoted research-based harm reduction strategies, shared policy best practices, and connected school districts with fundings for sustainable harm reduction practices. And Norma's work has resulted in the adoption of the Naloxone Deployment in Schools Toolkit, which she created, by the Colorado Consortium for Prescription Drug Abuse Prevention. Through the Colorado Consortium, this toolkit has been shared with substance use prevention coalitions across the state of Colorado for communities to be able to do their own advocacy for substance use harm reduction in schools. These strategies have also supported the implementation of naloxone on Boulder Valley School District middle and high school campuses. Thank you, Norma, for your tireless effort to ensure that not only Boulder County schools, but schools across Colorado have the tools needed to save students' lives.
Not going. It's not going. Ah.
I think you're muted, Norma.
Click it just once. Can they unmute you?
Tell me. Okay, no. Oh my God.
It's
You're good.
Okay, now I'm unmuted. Oh my goodness.
Correct.
Oh my goodness. Okay. Well, first of all, thank you, Audrey, for nominating me for this profoundly meaningful award. I just want to set the record straight. First, I'm not the pharmaceutical scientist who created naloxone. I'm not a member of the state legislature that passed the laws authorizing schools to obtain and deploy Narcan without liability. And I'm not the employee from the Association of School Nurses that developed training materials specifically for the school nurses. But what I was in this case is a curator. So I curated, which Audrey talked about, is that I located and assembled the tools necessary, plus I added a few of my own. So my goal was to eliminate a barrier because developing new health protocols can be really a daunting task for overburdened school districts. Their health teams are really stretched to the limit. So I am absolutely so pleased that Boulder Valley School District is in the process of deploying Narcan, and I hope other school districts in the state will follow. I do want to thank Jamie Feld of the consortium. She's been very supportive, and as Audrey said, the toolkit is available on a Google Drive for any Colorado school district to use. So my message to anyone on this call is that if you're a school district, if you know of anybody who works for a school district that might want to deploy Narcan, or if you have connections with agencies that want to encourage their school districts to deploy Narcan, please refer them to the toolkit or refer them to me. And thank you one more time for the award. I really appreciate it.
It would be just like one of our recipients to use their acceptance speech to promote all the good work they do. Amazing. That is why we cannot do it without you. I'm going to move on to our next recipient, though. The ecocycle Schools program is recognized for providing composting and nutrition education programming for many years in our community schools. We applaud your ability to pivot the program during COVID to provide a virtual training platform so children could continue to learn about important sustainability practices safely. I'll turn this over to Heather Houseworth, one of our program specialists in that area, to highlight the accomplishments of the ecocycle Schools program. And then after that, the award is being accepted by Mark Bushman, Assistant Director of the ecocycle Schools program.
Thank you. My name is Heather Houseworth. I'm the Farm to ECU Program Specialist at Boulder County Public Health. We provide nutrition education, garden support, and locally grown produce to 75 childcare programs across Boulder County. And I wanted to take this opportunity to thank Sindra Dietz, Mark Bushman, and Tina Bose of the ecocycle Schools program for their amazing partnership over the past 3 years. They have been providing composting and nutrition education programming for Farm to ECU participants in the city of Boulder for the past 3 years, which has been a huge benefit to childcare programs. In 2020, they pivoted successfully to make all of their programming virtually due to the pandemic. And that was able to allow us to continue to support childcare programs throughout the year, which was an amazing benefit to our programs in the city of Boulder. I did a couple calculations, and I think if my memory serves me correctly and my notes serve me correctly, it looks like we've served over 50 programs and over 500 kids through the partnership with the ecocycle schools program. So I wanted to take this opportunity to introduce Mark Bushman, the school program coordinator, who will be accepting this award.
Hi, thank you so much. Look, we just got this in the mail. Oh, you can't see it. It's beautiful. We really appreciate the opportunity to work with Boulder County Health and to reach into the classrooms at the ECE centers and work with those little people on eating healthy and composting. And it's been an honor. And this past year, we got to work on developing a new lesson. Tina was a huge part of that. It's mostly her genius idea, and it's just been a great experience. Thank you.
Thank you so much, Mark, and for all that you do. I love how you called them little people. That's so exciting. Our next recipients, the Community Economic Development Partners. This includes both the Latino Chamber of Commerce of Boulder County and the Boulder Chamber of Commerce. And they are being recognized today for their outstanding work educating our community and championing public health interventions for COVID disease prevention. We commend your support and advocacy for businesses in need and your help for our community throughout the COVID crisis. I'll now turn this over to Lane Drager, our Consumer Protection Program Coordinator, to share with you the accomplishments of both our Community Economic Development Partners. This award, after Lane speaks, is being accepted by Corinne Waldau, Senior Director of the Economic Vitality for the Boulder Chamber, and by Berenice Garcia Tellez, Vice Chair of the Board for the Latino Chamber.
Thank you so much. Good afternoon, everyone, and thank you for joining today. This is definitely one of the highlights throughout my career, is to hear the information and the partnerships that are created in so many different programs and so many facets that help our community. So it's very exciting. My name is Lane Drager, and I work in our Environmental Health Division. Over the last year and a half, I've been in a different role. I've been in a COVID liaison team role in response to the pandemic, and that is really what's generated this wonderful partnership that I get to highlight today. So I'm honored to present the Healthy Community Award to two of our amazing economic partners. We've been very fortunate to have wonderful partnerships with all of the various economic partners, but the two that we really wanted to highlight today have gone even more above and beyond than the other partners have. The Latino Chamber of Commerce of Boulder County and the Boulder Chamber of Commerce. These partners have worked tirelessly, and that is such an understatement to say. Really just have become almost additional extensions and staff people to spread the word. They have supported the community and helped ensure the efforts of public health were reaching our various community folks. They went above and beyond by hosting over 200 webinars and to provide information on our ever-evolving world of what was happening within COVID. We had so many various state orders last year that had many detailed nuances, very sector specific, and continue to navigate that field. I don't even know how many questions. Corinne probably, in addition to being an amazing partner, is also an amazing fact keeper and has, all the various stats on how many businesses, how many questions and things like that. But that partnership has continued on. So, these nominations began at the beginning of the year, and we were all excited that things started to go much back to normal, and the Delta variant really changed that. And both partners really jumped right back into gear to again host webinars as we had to put additional mask orders in place, and again re-establish those communications with all the business folks to really make sure that they knew what was going on, make sure they were equipped with signage, and answer the myriad of questions that started to pour in. They've had the pulse on the community. In addition to answering those questions, they've really been the true extension of public health into the community. Their proactive efforts really helped us maintain that vital communication with the community and the business world, as well as provide that support rather than just enforcement of public health orders. It was really an ability to bridge that and help people understand a lot of the why. They've been such a strong voice in carrying those key messages to our community. And there's a whole host of folks to thank, and I know both Bernice and Corinne are going to get a chance to speak, but I do want to make sure to mention many of the other folks that were part of this effort. So in addition to Bernice, the Ricardo Cabrera, Rachel Garcia, Liz Salas, Kevin Ortiz, and Astrid Villalobos from the Latino Chamber. And then I have to make sure to mention Maciel Leon, who was not a public health employee, but basically became one last year, as did many county employees who did so much of the translation efforts and just was, again, one of the amazing team members on our liaison team. And then from the Boulder Chamber, John Taylor has been a wonderful partner, Tyler X, Maya Cordero, and of course, Corinne, who you're going to get to hear from. And I really want to also thank all the staff from across the county. So we built a team out of fractions of people over the last year when we were dealing with COVID, and we had folks from so many walks of life that had no previous experience in dealing with public health or public health orders, and they all jumped in to support our community, and they did an amazing job and really support the business community in specific. So with that, I would love to turn it over, I think first to Bernice and then to Corinne to share some words. And again, thank you so much for your partnership. You've been wonderful, both of you.
Hello, everyone. Hola, amigos. Thank you very much for this, for presenting this award to us. Yeah, you're right, Lane. Most of us, we didn't know anything about public health, but we learned a lot last year, and also about financial information. And thank you for the collaboration with the Boulder Chamber with Public Health. Maciel, wow, she was amazing. Thank you for all those recording hours we had with her, because having the information in English is important, but translating it into Spanish and convey the message that is cultural relevant and linguistic appropriate, it's tough. So I really appreciate her efforts, and thank you for the support. And also thank you for the community partners that help us with our clinics that we hosted. We were able to vaccinate around 1,200 people from the Latino community. So thank you very much for that. And también quiero decir un mensaje en español porque there are some Latino businesses that are joining this award ceremony. Muchas gracias, negocios latinos, por confiar en nosotros, por recibir nuestra información, por ser pacientes y por darnos su confianza. La verdad, lo agradecemos. Muchas gracias. Thank you very much. Over to you, Corinne.
Thank you. Thank you very much, both of you. And Lane puts it lightly. I think there are like 55 orders. And then when you break that down by industry, it was navigating a lot for businesses. And when you start to think about the information and how to put that out there, that's what this partnership was created. And I want to thank you so much for this recognition. Seeing the plaque come yesterday brought actual tears to my eyes because it reminded me of the hundreds of hours spent on this partnership in the past and again in the present. We're continuing to do this work because we know how valuable, and we've been told how valuable it is with the Latino Chamber and with Boulder County Public Health. I'm accepting on behalf of the Boulder Chamber team, but I'm also accepting on behalf of our chamber, our economic development, and our municipality partners, who trusted us to provide this resource across the county to businesses, across industries, to push this information out and to work so closely as a centralized source. We value this amazing partnership with both the Boulder County Public Health and the Latino Chamber over the past year, because it really defined what partnership is. It was separate organizations that broke through traditional barriers and worked together to solve a problem that existed. Overnight, we created a solution. We came together, we created a solution, and then it took off. We created over 205 webinars with over 7,000 attendees, and answered thousands of questions. And we've heard from businesses in other counties that wished a solution like that existed in their county. And I really do hope at the end of the day that we save jobs and we save businesses. We've gotten a lot of thank yous. Even during all of this, we've gotten a lot of thank yous for having trusted source that people and businesses could go to get the information to help navigate those many orders, many orders, and understand what they needed to do to keep their business open, to survive, to keep their employees employed, and to keep people safe. And so I really hope that we can continue this partnership, to continue to play this role as that bridge. But I also want to say that I want to thank Boulder County Public Health and Boulder County, because as Lane said, so many people played a part in this. I have certain staff at Boulder County that pop up on my email before my own teammates. The Lane Drager, Zach Swank, Jesse Rounds, Trina, Summer, Cecilia, Matt, Alexandra, Marnie, Cami, Andrew, Ambra, Zach L, Tessa, Mary O, Mary T, Lucas, Andrew, Kate, Rebecca, Melissa, Maciel, Dr. Urbina, Kelly, and more. All of you worked so closely and made businesses an important part of this process, because they helped prevent disease in our community. And I want to thank you for taking it so seriously and working so closely with us. And I want to thank you, Lane. Thank Jesse, thank Zach for being Uncle Lane, Uncle Jesse on those webinars, for being a trusted source for people. And I just want you to know that we'll continually to be here to support the community, both individuals and businesses, as we collectively try to prevent the spread of COVID-19, save lives, mitigate the impacts on our economic vitality, and recover from this pandemic together. So thank you again for this.
Corinne and Berenice, wow. I mean, there's not much more I can say, but what I do hope is that as we all work together to fight the enemy that is COVID, and hopefully someday come out of this not having to answer 50 questions a day about it, that we continue working together to help protect and promote health. I think this is a positive reframe. We can work together throughout pandemic times and non-pandemic times, and I'm looking forward to that opportunity with all of you. Our next award recipients are the health services staff for both the St. Vrain Valley and Boulder Valley School Districts, as well as the private school COVID staff. They are being recognized for their exceptional dedication to promoting and implementing science-based strategies to prevent the spread of COVID in their schools. We commend them for their tireless dedication to working directly with teachers, families, students, and public health partners to successfully enact effective public health interventions. I'll now turn this over to Sandra Sonoda, the lead epidemiologist registered nurse for the K-12 epidemiologist team, to share with you the accomplishments of both the St. Vrain Valley and the Boulder Valley Health Services staff and the private schools COVID staff. After Ms. Sonoda, these awards will be accepted by Sophia Yeager, the Health Services Coordinator for St. Vrain Valley School District, and Stephanie Farron, Health Services Director for BVSD.
Hi, everyone. This is in recognition of Boulder Valley School Districts and St. Vrain Valley School District's health services personnel. with whom the K-12 EPI team has been working for the past year to support schools in their COVID response. And their staff of nurses, health room staff, and paras, health clerks, attendance clerks, who communicated with principals, teachers, parents, coaches, truly deserve the recognition associated with this Healthy Communities Award. We are still working on this response, and believe me when I say we are answering questions as we are talking right now. That's not a joke. This recognition is because they all worked so hard for so many months to make sure their schools, their students, and their students' families were safe and healthy. This has really been a year like no other. Boulder County Public Health is deeply indebted to their tireless, unselfish commitment to their schools, their students, their communities. We're grateful for the untold hours talking with parents and students about their children's risks, symptoms, sports, contacts, classrooms, families. Some of those conversations were with families, some of whose members were hospitalized. Their health services staff learned the CDPHE guidance by heart, including when the guidance changed on a dime. They took countless temperatures, taught students the correct way to wear their masks, in other words, not under their nose, poured over an infinite number of symptom screening forms, ensured hand hygiene and social distancing, helped figure out distances between desks in way too many classrooms. They tirelessly advocated for safety and health for all of their principals, teachers, and families. They also told us about kids who needed food, stable housing, safety from abuse, or mental health help. They told us about families who lost a loved one because they caught COVID. They did all of that and still helped guide the family of a newly diagnosed student with diabetes. They still worked with other families who had to navigate medications for their children's seizure disorders. They still worked with special education teachers and staff and helped with students' case management. They helped all of their schools to navigate their COVID response along with accomplishing all of their other critical roles. Some of them did all of this in a second language. I want to speak directly to you in health services. We at Boulder County Public Health cannot thank you enough for all you do to help be the bridge between your schools, your families, and public health. The tendrils of this pandemic likely would have reached deeper and done more harm to your families without you in health services. You adapted, you innovated, you became trusted leaders in your schools. You are and have always been school champions. We cannot thank you enough for your cooperation, hard work, diligence, resourcefulness, caring, and support that you have demonstrated to your schools, families, and communities. Boulder County Public Health could not have even tried to contain the spread of COVID-19 without your help. Our communities and schools are better places with you in them. And I know we were having some technical difficulties, but with that, I'd like to hand this over to the coordinator of health services at St. Vrain Valley School District first, and then to Stephanie Farron, the director of services at Boulder Valley School District. And I want to have a shout out to all of our private school partners, many of whom do not have nurses working directly with them all of the time. And still, we maintain partnerships and help to protect their communities and families as well. So with that, I'm handing this over to some of the most phenomenal, caring, and really busy women I have ever met. It has been our privilege to work with them.
Soda, can you hear me?
Yep.
Okay, great. Sorry, I wasn't able to pull the video up. This is Sophia Yeager. I'm the Health Services Coordinator for St. Vrain School District. Thank you, Soda. Those were great words. And I did want to I'm really honored to accept this award on behalf of my team. We are 15 nurses and we have 54 health clerks, and at the end of the day, this work could not have been done without a monumental movement of people to make sure that we were keeping our community safe. So I agree with everything that Soda said. This is our team right here on the small but mighty team on the right. And I don't know if you can see our t-shirts there, but it says stronger than COVID. So I don't have words to say how amazing working with our health services team has been, and also our partnership with Boulder County Public Health and our Wells County Public Health actually. But we're really honored to have this. And like I said, there's nothing, we could not have pulled this off without the amazing staff that we have in St. Vrain School District. So I'll pass it over to Stephanie, and thank you so much, Soda, and Boulder County Public Health for nominating us for this.
Thank you, Sophia. And thank you, Soda, and the rest of the team at Boulder County. I echo everything that Sophia said. This has been a hell of a couple of school years, and it's been, unlike anything that any of us have ever done. The relationship and the trust and the partnership that we've had with Boulder County Public Health and Broomfield, and working with Sophia in St. Vrain as well, and hopefully some of our private school partners in addition, it's just been remarkable. Sophia and I both connect with our school nursing leadership throughout the metro area, and we have a relationship unlike any other district, I think, in the state with our health department. And we are so very, very thankful and grateful for that. My team is on the left side of the slide there. That was our end of the year last year. And we all went out and had a really lovely time together and said goodbye to COVID. Unfortunately, COVID didn't go away, so we're back here again this year. But I have 21 nurses that work with us in our schools, and over 57 health room staff. I think our assistant principals and office managers have all learned more about COVID and quarantining and isolation than they ever could have hoped to want to know. And we, again, like Sophia said, we could not have done this without everybody just coming together, and with our community coming together to support us. So thank you so very much. We're so appreciative of this and of all of our time working with all of you as well. So thank you.
Thank you, guys.
Thank you, Soda.
Thank you so much. I don't think words could express how much we appreciate our relationship with the schools, and it's an understatement that the amount of work done by everyone in that collective conversation, I'm so absolutely impressed and grateful to. Our next award recipients are the BoCo Beans institutional supporters. That includes Aramark, the Boulder Valley School District, and the Boulder County Farmers Market. They are being recognized for launching the beginning of a sustainable, local, healthy, and equitable food chain. Your support for sustainably grown local food and work to ensure that healthful proteins are provided to our community, especially those who may be facing barriers to accessing healthy foods, is commended. I'll now turn this over to Tessa Hale, our healthy beverage and food advisor, to share with you the accomplishments of the BoCo Beans institutional supporters. And the award after that will be accepted by Stephen Meinhardt, Director of the BSD Food Services, and Brian Copham, Executive Director for the Boulder County Farmers Market.
Tessa, you're on mute.
I wonder if Tessa is having some technical difficulties.
It looks like that, Tina, she just left. So she might be coming back in. I don't have the talking points that she would have used. So we might wait 1 second to see if she can make it back in.
Or if you'd like to switch the order, this is Stephen calling from BVSD. Brian and I could also present while Tessa works things out, whatever you'd prefer.
I think that should be fine. Stephen, this is Camille. It's a little out of order, but let's go with the flow. Would you like to go? And then we'll wait for Tessa to come. Is that okay, Tina?
That sounds great.
Okay, I'll jump right in then. So my name's Stephen Menahart. I'm the Director of Food Services with Boulder Valley School District. We had an amazing event last week that Tessa organized out in the farm field between here and Longmont. We're super excited to buy the dry pinto beans and utilize them in our meals program. We have about 10% vegetarian students in our district, and so we always feature a vegetarian option every day as a hot entree. And some of the bean dishes we serve are things like nachos. We serve tamales with rice and refried beans. We serve multiple refried beans in multiple applications. And so it's one of our cheap, healthy and nutritious vegetarian options. You know, it just sort of harkens to global cuisine, like rice and beans is a staple around the world. And so we use that combination in our meals program since we have a limited budget for ingredients, and we try and buy the best, least processed, most whole ingredients we can. So as soon as Tessa mentioned, hey, we have an opportunity to buy dried pinto beans, we were like, yes, for sure. And we had also been changing our process. We now work in a 33,000 square foot culinary center. It's a real gem. If anyone wants to come visit, we're happy to give tours. And it's just a great facility. We have a cook chill process, which means we have a 100-gallon and 200-gallon kettle. And so we're able to do larger quantities than we ever could before. More consistency, food safety, and food quality are the emphasis. The funny story about the dry beans, and then I'll let Brian talk, is the first time we ran them in our new system, we were assuming we needed to soak the beans just because most people pre-soak beans, whether that's at home or in institutional use. And we filled our 200-gallon kettle with beans and then filled it to the brim with water and then left and went home. And then, of course, the next morning we show up at 5 a.m. and the 200-gallon kettle is just spilling beans everywhere, every which way. And then we have this giant paddle that we use to mix the kettle, and it was like stuck as if it was in concrete. And so we had to remove all the beans. So anyway, then we just went to a different culinary approach, which is just cook the beans from dry. So we now actually cook these dry pintos from a dry state, and we just cook them about 3.5 hours. We add the spice bomb, and then we puree them through an emulsifier and serve them. And the quality has been outstanding. You know, we've worked through a few process things like how to make sure there's no rocks or stones in the dry beans, which is always a chance. And so, you know, we've had some process things, but the quality is so high. And then going out there to meet Van Toyen and the farmers out in the field last week just reminded us, you know, this family's been farming for 100 years, literally 100 years in this county. And that we're able to support their what they do is just a great feeling. So I want to thank Tessa and everyone that's helped us partner on this.
Shall we have
Tessa.
Brian say a few words, or do we want to jump to Tessa?
I can hop in. Hi, thank you all so much for dealing with my technical difficulties. Stephen, thanks for hopping in and giving an overview of your awesome work. I am loving, this was one of the coolest projects I've worked on in my career. BoCo Beans is an initiative to build a food system that supports local sustainable agriculture and makes healthy foods accessible to people who sometimes rely on institutional food, like kids in schools who rely on their school lunch as their main meal, people who are in prisons, people who rely on food pantries, and just, am I muted? It shows that I'm unmuted. Can you hear me? Yes, okay. Great. So this program really addresses two of public health's top strategic priorities. One is health equity. As I noted, oftentimes institutional foods is high in saturated fat and sodium that can lead to poor diets and chronic disease. And so working with institutional partners to increase the access to foods like locally grown beans that are full of protein, they're high in fiber and minerals and antioxidants. We're also helping to reduce heart disease and other dietary related chronic diseases. And from another strategic priority for public health, climate action, bean farming is a key strategy for addressing climate change. Bean farming promotes soil health and also can have a lower carbon footprint than many other crops because it requires less water and fertilizer. And in fact, the Harvard School of Public Health said that an emphasis on plant-based proteins is the single most important contribution that institutions can make towards environmental sustainability. So in 2019, Jules Van Tine, who, as Stephen noted, is a longtime bean farmer, took a leap of faith and grew 98,000 pounds of pinto beans. And then COVID hit and everything was up in the air. People weren't in person in schools, people were being released from jail. And so it was really unclear what was going to happen. But thanks to our amazing institutional partners, all of those beans were sold. And really, these institutions, Aramark representing the Boulder County Jail, Stephen Menihart from Boulder Valley School District, the School Food Project, and Brian and Nancy Copham from the Boulder County Farmers Market made it possible for us to be building a healthy, equitable, and sustainable food system. So thank you so much.
Great. Am I up? Well, we're just incredibly honored to be recipients of this award, and I know that with the, as Boulder County Farmers Markets, I'm Brian Copham, the people don't often think of health when they think of the farmers markets, and so this is really a unique honor because the farmers markets and specifically local agriculture, local food systems do have quite a role to play in the health of the community. This project is remarkable for a number of reasons, one of which is there's not a lot of opportunities that farmers have had to localize commodity products. And this is one of those opportunities that's really been embraced. And I think I was just a little bit excited when Tessa couldn't get on to do her thing because I was hoping I could turn the tables and say, well, this is really Tessa's achievement. She deserves this award. Because it's risky to do this kind of thing. You know, our community often has great ideas for farmers, things they should grow and practices they should use. But when it comes down to it, the farmers are on their own to try to figure out how to make it work. And this is one example where an agency jumped in, and specifically Tessa, jumped in and helped develop markets and find customers and figure out how it was going to be distributed and really support that farmer in this. So my hat's off to her and her team because it happens because of her. And I have to say, Mickey, who is our food access specialist, is in the audience somewhere. She couldn't get on the presenter track. She's a huge part of this for us because she helps coordinate this with food access. But I have learned in my 8 years here that we will never go wrong by saying yes to a Boulder County Public Health suggestion. So when we had the opportunity to participate in this program, it was a natural. So thank you, and thank you, Tessa, so much for making this happen.
Wow, I feel like we did just get an award. Thank you so much for those kind words, and what an amazing partnership. What a great story about this soaking the beans. That one's going to stay in my head. So that was fantastic. I'll move on. Our next award recipients are the community ambassadors and cultural brokers. They are being recognized for developing collective strategies that ensure COVID-19 vaccines are accessible to those who face barriers to information and healthcare, and to those that are most impacted by COVID-19. The collective work of your organizations in supporting and improving the health and well-being of our entire community is to be commended. The agencies being awarded include Community and Neighborhood Resources Division of the City of Longmont, El Centro Amistad, El Paso, El Comité, Out Boulder County, Peak to Peak Housing and Human Services Alliance and the Nederland Food Pantry, the Center for People with Disabilities, Communities That Care, the NAACP of Boulder County, and BoCo Suma. I'll now turn this over to Chris Campbell. He's our Emergency Management Coordinator at Boulder County Public Health to share with you the accomplishments of the community ambassadors and the cultural brokers. The award is being accepted by Jorge de Santiago, Executive Director of El Centro Amistad. Chris?
Okay, so always looking to make sure I'm live. There we go, great. Good afternoon, everyone. Again, my name is Chris Campbell, Emergency Management Coordinator with Boulder County Public Health. I really have the honor to present a Boulder County Public Health Healthy Community Awards to an incredible group of community ambassadors and cultural brokers. And this is truly in recognition of their leadership in our community in our COVID-19 vaccine equity strategies. So really since January of 2021, this group has worked tirelessly to co-create and implement vaccine equity strategies and truly ensure that priority populations in our community have equitable access to COVID-19 vaccines. Many strategies that this group has worked through, but they include countless hours spent in outreach and education, one-on-one conversations, on-the-ground work at vaccine equity clinics, supporting and navigating the registration process for vaccines, training and guidance on cultural responsiveness, and the list goes on. You know, what has been truly remarkable about this coalition is the powerful grassroots model created by this group, and it's one that I'm confident will truly impact systemic change in our community. It's been an approach of shared leadership, shared power, shared decision making, and cultural responsiveness, and it's truly remarkable work. This group has really made a tangible impact on the lives of Boulder County community members, and I'm really honored to be able to recognize them today. So I will turn it over to Jorge de Santiago, and Jorge will accept the award on behalf of the group. Thank you so much.
Thank you, Chris. Thank you, everyone, for this recognition. I believe, you know, that to me, collaboration is crucial when events like this arrive in our communities. I think it's, as you well know, collaborations are not easy, but when we put to, you know, in first place our communities, we can accomplish a lot. So I think it has been a challenge, you know, for the whole community in Boulder County since last year, really dealing with with COVID-19 and losing a lot of community members. So I think the idea of really coming together and really collaborate with Boulder Public Health to address the access and equity for all communities to access vaccination clinics was crucial. It's a lot of work that we still need to do, but I think collectively we have the opportunity to accomplish. I think all the organizations that was mentioned for this award, they have done a lot. And, you know, I like, Chris, what you just mentioned, that we creating systems that we can adopt, that they're working, and something that we can actually implement for future events, or just having available in our communities. Something that we have to always be alert that we cannot leave communities behind. All communities are important, you know, especially in pandemics like this one. Our community, Latino, I'm speaking from the Latino community in particular, are suffering. They lost jobs, they lost family members, friends. But the most important thing is that we came together to really provide the trust, provide the access, and provide the equity that they needed it. I'm glad that we have this collaboration with public health and with all the partners in this effort. And what I want to really recognize that it's not just the organizations, it's the people who make these organizations great. You know, I think every single organization, they should recognize their staff, their volunteers. Personally, I want to recognize the team of promotoras de salud at the Centro Amistad, who have been, you know, providing a lot of hours, efforts, and not actually even risking their lives, you know, exposing themselves to COVID. But at the same time, it's important to really connect with our communities. The team at Amistad, you know, all the program coordinators, the program directors, and the board of directors, they have been supporting our organizations. And I think I will speak from every single organization. I see this, that we are strong together, and let's value every day the work that our teams do. And to finalize, I want to really thank you, all the county public health leadership team, but especially the vaccination group that has been coordinating the vaccination clinics. You know, starting with you, Chris. I mean, the whole team has been amazing, really providing these opportunities and really listening to the systems that have to be created to really change what it hasn't exist or something that has been putting barriers in front of community members. Quiero agradecer a toda la comunidad por vacunarse. Es importante que la comunidad se una, se vacune, especialmente nuestra comunidad más cercana. Quiero agradecer al equipo de Amistad, a los promotores de salud, a todos los voluntarios de cada organización y a todo el personal de salud pública, especialmente al grupo de la coordinación de las clínicas de vacunación por su tremendo trabajo en el esfuerzo de vacunar a nuestra comunidad. Muchas gracias. Thank you so much for this award, and we're going to continue working together until we accomplish our goals. Gracias. Thank you.
Gracias, Jorge, and thank you to, as you said, to all the people, the volunteers, the people doing the work. We are all in this together, and we just thank you for your partnership. I'm going to move on to our next recipient. They are the many COVID-19 volunteers and Medical Reserve Corps of Boulder County. That are being recognized for selflessly offering their time and talents to protect our community by assisting Boulder County Public Health in key aspects of COVID-19 pandemic response. Simply put, the COVID-19 volunteers and the Medical Reserve Corps of Boulder County have saved lives in our community. At this time, I'm going to turn it over to Carrie Middleton, our emergency management planner, to share with you more specific details about their work. And after that, this award is being accepted by Corina Bercentes, a member of the Medical Reserve Corps. Carrie?
Good afternoon, everybody. Also just want to make sure that I'm live here before I start speaking. And thanks everybody for being here for this great event. So I'm really excited to say a few words about the Medical Reserve Corps and our COVID-19 volunteers, and to recognize really the extraordinary work that they've done. So as Camille said, our volunteers, and this is a group of many volunteers, many of them clinical, many of them not, who really served in key areas through our pandemic response. So that includes supporting vaccination clinics, that includes testing sites, that includes the COVID-19 Recovery Center, which is a place for unhoused people to quarantine. It includes case investigations and more. And I won't give you a ton of data, but I do want to point out two numbers. One is that over 350 of these volunteers served through the response. That number is counting because, as someone else said earlier in this event, we're still in the response, so that number is growing. And they served, again, this number is growing too, over 7,900 hours. So that, I think, speaks to the extraordinary commitment that these folks have. But what I really want to emphasize in these intro remarks is not those numbers, but that without that group of dedicated volunteers, to echo kind of what Jorge had said, some of whom were putting themselves at risk because they were volunteering pre-vaccine with appropriate PE, of course, but pre-vaccine with potentially positive folks, our response to the pandemic would have unfolded really, really differently. And so what these hours served and these numbers of people involved represents is really lives saved. And so I really can't emphasize enough the impact of their work or our gratitude to them. So just one quick example of that, as we all know, Boulder County is in a really fortunate place where we have a really high vaccination rate. We would not have reached that point as quickly as they did without all of our volunteers supporting those mass vaccination clinics that we had at the Boulder County Fairgrounds. I also want to emphasize that our volunteers not just donated their time and talents, but they also helped with process improvement. So we were always looking at how can we do better? Whatever area we were looking at, whether it was COVID Recovery Center, vaccines, testing, case investigations, and our volunteers had and were willing to offer, good suggestions to help us keep improving. The other thing I just want to say is that our volunteers really did have, and still have, extraordinary dedication. So we have volunteers who put their own work on hold, for example, in order to volunteer every week at a vaccination clinic. We have volunteers at testing sites, without whom those testing sites might not have been possible or nearly as easy. And many of those volunteers have been doing it for months. And because the work is outside at times in some places, in the winter, they might be there after dark when it's cold, and they continue to do that. At the COVID Recovery Center, we have volunteers who they make sure that there's coverage for wellness checks at that center every day of the week. So that includes every single holiday, and that includes the snow that we get here. And the case investigators, I know it donated hundreds and hundreds of hours. So their work has been amazing, and this award is really well deserved. So I'm really excited to be here and that they're receiving this public recognition. So it is my pleasure to introduce next Corina Bersentis, who is one of our Medical Reserve Corps of Boulder County volunteers. And she is a physician who supported our mass vaccination clinics at the Boulder County Fairgrounds. And Corina has very graciously agreed to accept this reward on behalf of the group and represent the group. So volunteers, you're amazing. Can't thank you enough. And I'm going to turn it over to Corina now.
Thank you, Carrie. I hope you can hear me. It's really an honor to accept this award on behalf of the Medical Reserve Corps and the COVID-19 volunteer of Boulder County. I'd like to thank you, Carrie, for this nomination, and also to Boulder County Public Health for this recognition. It has truly been my privilege to be part of the COVID-19 response, and a joy to work with the other volunteers alongside the Boulder County Public Health staff. I began volunteering back in December, and at that time, a vaccine was still limited, and we were lucky if we could get 100 people vaccinated a week. But very quickly, we expanded to over 800 vaccinations a day. And I think that's really amazing. And I think this could only be possible because of the organization and the dedicated people who work in our public health department. So I was grateful for them and their efforts. Over the past year, I've had the pleasure of meeting many of the volunteers, and we're really a large and diverse group. We span all ages and all backgrounds. We have high school seniors to senior citizens. We have, as Carrie mentioned, health professionals from all areas of healthcare, as well as people with no medical background. And we filled many roles working at the vaccine site, the testing site, and the CRC. But I think we all shared a common goal, and that was to keep our community healthy and safe and to try to end this pandemic, do whatever we can to get to that goal. For me, it has really been a privilege to be part of this effort. I know it has enriched my life in many ways, giving me a sense of community and optimism for the future, especially after such a tough 2020 year. I also thought it was especially rewarding to work in our equity clinics. These were specifically designed to reach the underserved people in our communities and to help provide vaccines to people who have barriers to accessing healthcare, and I thought that they were particularly successful. Every day, I continue to be inspired by the people who volunteer, and I appreciate the work that they do. And on their behalf, I give my sincere thanks for this award. Thank you.
Thank you. Thank you, Corina. Thank you to all of the volunteers and the Medical Reserve Corps. I'm just so, I think most of you know I'm very new to this community, and I'm absolutely impressed by every single recipient in their story, but by the community as a whole. It's been an honor to be here for just this short period of time and learn all that you do. Our next award recipients are members of a team that we affectionately at Boulder Public Health calls the CIDER team, and it stands for Community Infectious Disease Emergency Response Team. That team consists of Boulder Community Health, Longmont United Hospital, Avista Adventist Hospital, Good Samaritan Medical Center, the UC Longs Peak Hospital, Boulder Medical Center, Fraser Meadows, the American Medical Response, Salud, CU Health Services, Clinica, the BC Office of Emergency Management, the BC Coroner, and the City of Longmont Emergency Manager. What you need to know is that they are being recognized for developing, supporting, and implementing a framework and a standardized and coordinated approach for responding to an infectious disease that could exceed our healthcare capacity and significantly threaten our community. The collective work of the CIDER team over the last 5 years has been invaluable in reducing the impact of what is now the COVID-19 epidemic in our community, and your team's planning and effective implementation is to be commended. I was actually asked to present this award yesterday when the CIDER team met during their regular meeting. And we are about to show you a quick recording of the presentation of that award. You'll get to hear from Carol Helwig, who is our Community Disease Program Manager at BCPH, sharing some of the highlights of the CIDER accomplishments. And then Dr. Mark King of Boulder Community Health will be accepting the award.
Really appreciate it, and I'm going to do just a very brief presentation for everyone on CIDER to share with the folks who are participating in the award ceremony to give just a little bit more background. I did put the logos of all the organizations that are represented in CIDR here for everyone to see, and just to provide a quick little history of CIDR. The team was organized in 2015. This was on the heels of the Ebola response, which now seems like it wasn't that heavy of a lift, but at the time it was, and we did have to mobilize and shift how we were doing things. Public Health had monitoring of travelers to the Ebola impacted zones, and our healthcare system partners had to shift how they screened people, and there was a lot that went into that. And so we really didn't want that to lose momentum, and so CIDR was formed in 2015 to have really a structure founded on the relationships from the people who respond to emergencies related to communicable diseases, and so we had that activation structure in place so that we could respond and activate during COVID, and the intention of it is to be able to have collective leadership when we're developing our response, and to be able to inform how we move together cohesively. And so I got a little nostalgic here and pulled up a risk assessment that many of you present here participated in back in October of 2015, where we looked at the probability, severity, spread, and intervention for the different communicable disease threats that could impact us. And this team foresaw back then that respiratory aerosols were the #1 risk that we were facing. And you can see here we had examples of measles and pneumonic plague, and MERS-CoV was on that list. And it's just really heartening to see that this group was engaged in planning and thinking about these things even way back when. And I should highlight that our second one is antimicrobial resistant disease, and we still have more work to do because that is still a threat that we're preparing for and working on. And here we began meeting as a group during the pandemic, March 24th of 2020. And I really think that having that CIDR foundation already built and being able to come together, and since the very beginning, I think our first case in Boulder County for COVID was March 14th, if I'm not mistaken. So within 10 days of our first case, this group was already meeting and already coming together. And I dug up the notes from way back then and found that back then we were talking about how to cut your gowns from reams of plastic, and I think that was shared by one of our IPs at Avista, and then I know that Boulder Community Health was sharing how to sterilize N95 masks using UV technology, and everybody was like bringing their N95s to each other to sterilize them and reuse them, and I have our old EpiCurve, one of the very first ones, where by April 8th we had 214 cases, and now we find ourselves in weeks where we have even more than that in a single week. So, and still being a little nostalgic, in 2015 when this group was first founded, there were 16 members, and now the membership is 58 members strong on this call. And really, I think it's those relationships is what makes this, and the ability to connect. And so I just wanted to thank everyone, thank all the organizations that are represented here. Just forever grateful that we have this living bridge built. And I invite anyone who would like to share a few words.
Hey, Carol, this is Mark King from BCH. I think what I would like to share is the incredible foresight that Boulder County Public Health had back in 2015 on the heels of Ebola to initiate this team. And I think this has made a huge difference in how we've been able to respond, prepare, strategize, and care for patients suffering from COVID, vaccinate our community to prevent them from getting COVID, work together to maximize safety in our healthcare institutions and in our community. And I really think it was you guys who started this process and really deserve a huge kudos to have had that foresight. And I think it's a tremendous group that will continue to serve Boulder County well as we move into the future and whatever we may face in the future. Thanks.
Thank you so much, Mark. We're really just the facilitators. It's all of our partners and members who show up every day and do the hard work every day that really make and shape this team. Thank you.
All right. Once again, Dr. King thanking us, Boulder County Public Health, when we're trying to give an award to this collective and amazing group of professionals that help to protect and promote health in our community. That was a great pivot for us also to give that award yesterday and be able to show it to you today. So thank you all for listening, and thanks to the CIDR team for their work. I'm going to move on to our final award recipients. They are the Healthy Drinks and Social Media Campaign members, and they're being recognized for developing and promoting a public awareness campaign about the negative consequences of sugary drinks. This team's research regarding the harms to health from sugary beverages and the racism in industry marketing, as well as your active support of more healthy alternatives, is to be commended. The Healthy Drinks and Social Media Campaign membership include Adriana Arriola, Greta Weddle, Dylan Morales, Fabiola Olivas, Gracie Shang, Sid Naredi, James Karain, Lily Lee, Nivedita Prabhu, Phoebe McLean, Violet Oliver, and Daniela Garcia, and I apologize if I have mispronounced your name in any way. I will now go ahead and turn this over to Tessa Hale, our Healthy Beverage and Food Advisor, to share with you the accomplishments of the Healthy Drinks social media campaign. And after that, this award is being accepted by Siddhartha Naredi and Gracie Zhang. Tessa?
Thank you, Camille. And this award is just really just the most inspirational group of young people I've ever met. Christina Edstrom and I ran this project, and I think, you know, it was kind of in the dark days of COVID when everything seemed so negative and there was so much tumult happening. Every time we had a meeting with these youth, we would just have permagrins and just say, oh, like, I'm so hopeful for the future. These young people are amazing. These are the future leaders in our community and in our country. And it was just so wonderful to have an opportunity to work with these 12 young people, these high schoolers who, as Camille said, they came together to run a social media campaign to communicate to their peers in Boulder County about the harms of sugary drinks and about the structural racism through the targeted marketing by the beverage industry and how that parallels outcomes in our community as communities of color are targeted by the beverage industry in their marketing. And then also, it was a very complex campaign. It was also, when you have these dietary related chronic diseases, how much more vulnerable people are to COVID-19. So this was really a youth-led effort. We threw these big topics out to the youth, and they researched, they dug in, they came up with the key messages. They researched social media platforms, and they decided that TikTok and Instagram are the two places to be. I highly suggest everybody check out their campaigns. On Instagram, it's hidden.sugar, and TikTok, it's hidden sugar. Today, we tabulated the numbers. This campaign received 828,000 impressions. So nearly 1 million impressions. They did just an absolutely incredible job. Beyond this campaign, several of these members have turned into huge advocates for our sugary beverage work. They have presented at the Longmont City Council, which actually I think was like one of the most influential testimonies that helped push us into passing a healthy drinks and kids meals ordinance just last week. They wrote letters to the editor, and they are just continuing on. And I'm so excited that 2 of these leaders are here with us today to accept the award. First, we'll hear from Sid Naretti and then Gracie Zhang. So I'll turn it over to Sid now.
Hi, everyone. My name is Siddharth Naretti, and I'm a sophomore at Peak to Peak Charter School. Gracie and I are both members of the youth-led Healthy Drink social media campaign, and our entire team is overjoyed that we were selected for this award, and we thank you for this opportunity to speak out a bit. From our first meetings online in February to supporting an ordinance in person in front of the Longmont City Council, I've personally been continually amazed and inspired by all the people in our team. 12 high schoolers from many different high schools all joined together to help our community be safe and healthy. We conducted our research and put together comprehensive posts that were easy to understand and informative. We wanted to help educate people, and in order to spread the information that we gathered, we put together social media campaigns on platforms that were carefully selected. As of right now, Ms. Hale touched on this a bit, but our Instagram has 106 followers with 30 posts, and our TikTok has over 1,200 views. Of course, none of this would be possible without the help and the support of our tireless sponsors, Ms. Christina Edstrom and Ms. Tessa Hale. Being a part of this team has been a profound experience for all of us. We have learned so many important skills, from effective researching skills to how to effectively market ideas on social media. We hope to carry these skills into the future and continue to make change in our communities. Thank you all for this opportunity.
When you're doing speak stuff, it shouldn't be when I'm sitting. By the way.
And hi everyone, I just unmuted. Awesome. So my name is Gracie Zhang and I'm a senior at Silver Creek High School. I am honored to accept this Healthy Community Award on behalf of all the social media campaign team as well, with gratitude. This internship experience has been so wonderful, being able to collaborate with all of the new peers from all across Colorado. From the start to the end of the whole process, Miss Christina and Miss Tessa have both been such a great guidance and mentor towards planning out the steps we should be taking in order to stay on track, and really allowed us to be able to take the initiative on the project, ensuring that our voices were heard very clearly. Taking inspiration from previous famous campaigns such as The Price on Our Lives, and being able to create our own campaign based on the visions and ideas we had was such an engaging and enlightening experience. It was so cool to see our ideas come into light, such as the downloadable wristband, which I made, and I had envisioned that since the beginning. Being able to work with such an amazing team and bouncing ideas off one another each meeting has made this campaign such a joy to be in, and I hope it is able to continue for future youth leaders. The research process of the campaign was also quite interesting. The teams we made, and we learned about the different health, racial, financial, and societal effects of sugary drinks, and it gave me a new perspective on the consumption of sugary drinks before going into the whole process. And learning how some industries and monopolies target certain racial groups and wealth classes in society was also quite alarming to me, along with the rising statistics of sugar consumption, and which can be heavily traced back towards sugary beverages. We are also so excited how the Healthy Drinks and the Kids Meals Ordinance was passed on the evening of September 14th with Greta's fantastic speech. So it is an honor. myself, and all of the campaign members to be a part of this ordinance support process, and we are thrilled that it's now in action. We hope that this campaign can continue in the future and inspire youth all over Colorado to possibly create campaigns of their own and continue to spread the message of the importance of healthy drinks being accessible in all restaurants, along with being informed of the negative detriments of sugary beverages and the monopolies which create them as well. Again, our Instagram is hidden.sugar. Thank you.
Gracie, thank you. And to both presenters, I want to say that I was there and saw Greta's speech at the Longmont City Council, and wow, just amazing. I was so honored to be there. And really what a great way to sort of tie a bow on this award ceremony, to have young people being honored for the work that they have done and hopefully will continue to do. Hey, Boulder County Public Health hiring managers, this is a group right here that we want to keep our eye on and have come work for us someday. But guess what? We are all working together to accomplish the mission and values of Boulder County Public Health to really protect and promote health. Health is in all parts of our community, as was really represented by this awards ceremony today. I want to express my gratitude to everyone who filled out a nomination form and to all of the review committees. I want to express my gratitude to everyone who came today and spoke, and how you thanked us when we should really be thanking you. And I want to end this ceremony really with a quote. I'm not really usually a quote type of person, but in an interview that Michelle Obama was doing after she and Barack Obama left the White House, someone asked her about what were her takeaways. And one really key takeaway that sort of reminds me of today was, she said, "We learned about gratitude and humility, that so many people had a hand in our success." And I know this from serving many years as a government employee and many years in public health. We cannot protect and promote health without all of us rowing in that direction, without all of us working towards those goals. And so with that said, thank you so much to all who put this together. Thank you to all the work that all of the recipients did and will continue to do to protect and promote health, and to all of our community partners. We said over 200, and that's probably an underestimate. Thank you for your partnership as we work together to keep our community safe and healthy. Thank you so much, and congratulations to all the recipients. Have a great day.